Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're going to dive into a real-life clinical detective story. It's pretty amazing, actually. We're going to see how one super simple reflex can basically unlock a huge diagnosis, revealing secrets that are hidden deep inside our body's own wiring.
So, picture this. You've got a patient with all these really baffling symptoms, but there's this one single powerful clue just waiting to be found. And believe it or not, it all comes down to a simple tap on the chin.
Okay, so let's meet our central character in this medical mystery. She's a 48-year-old woman, and she's come into the clinic with this whole collection of symptoms that are, well, they're both worrying and really confusing. Nothing seems to connect.
And this is straight from the case file. She's reporting this progressive muscle weakness. It's getting worse in her right hand. She's tripping a lot. And on top of that, she's got these twitches and cramps in her arms and legs. Can you imagine how unsettling that would feel?
So, this is the big question for the doctors, right? Are all these things just separate, unrelated problems? Or is there one single underlying process that could connect everything? This is where the real detective work begins. All right, so to crack this case, the first thing we have to do is sort out the clues, categorize the symptoms. The best way to think about the nervous system is like a big company. You've got the upper motor neurons. They're the execs up in the head office, the brain, right? They send out the big picture commands. Then you have the lower motor neurons. They're like the on-site managers, out in the spinal cord and brainstem, and their job is to carry out those commands and talk directly to the muscles.
And this breakdown here shows you exactly how damage at these different levels can cause totally opposite effects. So on the left, if you have damage to those executives in the brain, you lose that top-down control. That leads to things like increased muscle tone, spasticity, and really brisk reflexes. But then look over on the right. If the on-site managers are the ones that are damaged, the muscles lose their direct signal. And what do you get? Weakness, muscle wasting, or atrophy, and those little twitches we call fasciculations.
Okay, and here's the kicker. This is the crucial finding. Our patient is showing signs from both of these categories. She's got the brisk reflexes, that's an upper motor neuron sign, and she's got the muscle wasting and twitching, which are lower motor neuron signs. When you see that combination, that is a huge classic clue. It points you towards a very specific group of diseases, most famously ALS. So, this brings us to the hero of our story, really. The one test that's going to help nail down the diagnosis. We're going to do a deep dive into this one specific and super informative reflex, the jaw jerk reflex.
So what even is it? Well, it's just a stretch reflex. You're probably familiar with the one where the doctor taps your knee, right? The knee jerk reflex? This is the same idea, but instead of testing your thigh muscle, it tests the masseter muscle. That big chewing muscle right there in your jaw? Okay, let's actually trace the pathway of this signal. We're going to follow it step by step and see exactly how a simple tap on the chin can set off this whole complex journey through the nervous system. It's really cool. So it all starts with that tap on the chin. That stretches the muscle. Instantly, a sensory signal shoots up the trigeminal nerve, heading for the brainstem. Once it gets there, it connects directly with a motor neuron, which then sends a command right back down the exact same nerve, telling that jaw muscle to contract. And boom, the jaw jerks upward. This diagram gives you a great look at that pathway. You can see the signal coming in, and then the motor signal going right back out. And the really unique thing here, it's actually pretty rare for these kinds of reflexes, is that both signals, the one going in and the one coming out, travel along the very same nerve, the trigeminal nerve.
Okay, so now that we know how it works, let's connect the dots. How does this all lead to the final diagnosis? What does a brisk jerk actually reveal about what's going on with our patient?
First things first, we need to know what's normal, right? In most healthy adults, if a doctor does this test, you're not going to see much. The reflex is either totally absent or it's so small you can barely even notice it. And that's a good thing. That's the baseline.
But in our patient, the reflex is brisk. Her jaw jerks upward sharp and clear. This is a huge red flag. It's a major departure from normal, and it is an absolutely crucial piece of this puzzle.
So why is it so brisk? Well, think back to those executives in the brain, the upper motor neurons. Part of their job is to constantly send signals down to keep these more primitive reflexes in check. They're basically saying, hey, calm down. But when those upper motor neurons are damaged, that suppression signal gets lost. The reflex is, well, it's unleashed. It becomes exaggerated or brisk.
And what this tells a clinician is that there's damage somewhere high up, specifically above a part of the brainstem called the pons.
And this right here is the high-yield takeaway. It's what we call a clinical pearl. This isn't just some neat trivia, it's a pathologic sign. A brisk jaw jerk is a clear signal that there's damage to the upper motor neurons on both sides of the brain, a classic finding in conditions like ALS.
So there you have it. This one simple test was the definitive clue. It absolutely confirmed that an upper motor neuron problem was part of the picture. It solved a huge piece of the medical mystery and pointed everyone in the right direction for the final diagnosis.
It's just incredible when you think about it. It really shows you the power of these diagnostic tools that are just built right into our bodies. A simple tap on the chin can reveal so much about the health of the brain. It kind of makes you wonder, right? What other simple reflexes are out there, just waiting to act as windows into our incredibly complex nervous system?